Welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in today. On this show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at #PaymentMatters and follow me at Jeff Lin. Today's episode, we have two amazing guests, David Gates and Kevin Pawl of Boston Children's Hospital, a worldwide leader in pediatric care and the treatment of complex diseases and conditions. It is a nationally ranked hospital in 10 children's specialties. David, Kevin, thanks for joining me today. For the benefit of our audience, do you mind telling me a little bit about your background and experience and a little bit more about Boston Children's Hospital?
Jeff, thanks so much. This is Kevin. We really appreciate being able to collaborate, and hopefully we can share some of what our journey has been, and we love hearing from others and learning from them as well. I'm the Senior Director of Patient Access for the hospital, and leading the access effort is a bit of a unique challenge because we've got the hospital and we also have the physicians organization. So you've got the hospital side of the business and the professional billing side of the enterprise. But it's exciting, and I would be sort of lost without my partner in crime, David. I'll throw the ball to David for his introduction.
Hi, my name is David Gates. I'm the Director of Ambulatory Training and Technology at Boston Children's Hospital. I've been at the hospital for a little over 20 years. I grew up here, I like to say, and I work with the Epic system primarily in developing some pretty innovative ways to help solve some of the payment challenges and front-end experience challenges for staff and for patients and families. We've had a great, interesting journey over the past 20 years with a transformation in our revenue cycle and how we used to collect or not collect payments, and where we are today, where I think we are doing some things that are new and different, not only for us, but I think for other folks in the industry. So we're very happy to share this. So very excited.
Now, I left out how long I've been here because I was hoping David would seem older than me, but one of the unique things I think about David and I is we both actually started many years ago in the front end of the operation, and I think we've never really lost that connection to what happens at the point of scheduling, registration, and check-in. So both leading teams that are heavily involved in the patient's journey. So it's an exciting thing that we get to do, is be connected to the point of care, if you will.
Got it. That's interesting here. You've definitely probably seen the evolution of patient care as it's gone over the last 20 years. What has changed? Have you seen any of these changes result in problems from a patient access, patient care perspective?
Yeah, I mean, if you go all the way back to when I first started at Boston Children's, when we scheduled an appointment, we wrote your name in a book. And when you canceled the appointment, we flipped that pencil over and erased your name. And our volume reports were counting of the names in the book. And so I think much has changed in terms of, technology, people, process.
I think, not only from this experience of scheduling a patient, really mirroring what happened a long time ago in the airlines, but just reporting too, and advanced reporting and predictive analytics. I think that's changed a lot in the healthcare industry.
Absolutely. I think connecting the different parts of the organization with the technology, and when you think about the sort of digital front door, whether it's patients that are requesting appointments online or from our website, or calling into one of our scheduling centers, or just walking up to a front desk. Years ago, I think it was sort of a mom and pop shop feel. You had the secretaries in the individual departments, and now we've got a complementary system where we've got some centralized services that support the enterprise, and we've got some siloed services, so a bit of a hybrid model.
Being part of a pediatric children's hospital, do you experience any differences and challenges from a patient or a demographic perspective that's unique to a children's hospital versus a non-children's hospital?
Yeah, I think so. I've got two kids myself, and whether it's something that's a primary or a secondary diagnosis, an ankle sprain or wisdom teeth, versus a heart condition or something to do with the child's brain, I think that you need different care and services for those different types of patients. Parents will do anything for their kids. They want more choice when it comes to the simple things like ankle sprains and wisdom teeth. They're willing to tolerate a bit more of the, disparate systems in healthcare that we're trying to change when it comes to a really sick kid, but we want them to have a great experience. We want it to be more Disney-like than, trying to put up with the siloed, disparate systems that we have in healthcare.
To add to that, with the pediatric population, you can imagine we have lots of families who come in with the two kids, young kids. Maybe you get the mom who's just bringing the kids in herself, who has to go to the kiosk and check in. It's like, where do you put everything? Where do you put your purse? Where do you put your bag? Where do you put your backpack, and keep track of the kids while you're interacting with the kiosk? So we have to keep those things in mind when we're going to implement any type of technology, because we don't want to make it increasingly difficult for the family. We want to make it to be a benefit to the family.
When they cross our threshold, we're hoping that the business side of healthcare is minimized, so that when they cross that threshold, we can really focus on the care of that entire family unit. And I think a lot of the technology advances that David and I are excited to be involved in do make it much easier for families. I know I just recently e-checked in for one of my kids' visits, and my wife didn't then have to pull that flexible spending card out of her wallet and find it. She was already e-checked in, and the payment was processed seamlessly, which was great.
I hear the terms about care, especially as part of the word healthcare, and then the business part. And the business part is sometimes not the glamorous part, about asking for payment and collecting payment. How has that transformed? Or it sounds like you went through some transformations around the payment portion in terms of collecting that from the patients or the guarantors.
I think a lot of our staff feel uncomfortable asking families for money. So part of it was training and education and having their supervisors support them. But we also find that kiosks are one of our best copay collectors, or even, I think David has a good story about past due balances with kiosks. Sometimes front desks are scary places for people, with asking of questions that you might be uncomfortable answering in front of other folks. I know, David, you've got a good story about the kiosks.
Yeah, when we first went live with kiosks, everyone was very concerned about patients being presented large balances at the kiosk for payments. And we didn't have any expectation that folks would be paying the large payments, right off the bat. But on day one, we ended up receiving a $5,000 payment from a family. And the interesting thing about that is it wasn't actually for the patient that was checking in. Mom was at the kiosk, and because she was the guarantor for the patient, it also looked across the other patients she was the guarantor for. And so it was actually the patient's sister bill that she was able to pay right there. And now we have families who want to pay their past balances at the kiosk rather than waiting for the bill to come in the mail. Going back a little bit further, we used to collect cash at all of these front desk areas, and we found that was a real problem, not only for the safety of our staff, but also for the safety of our patients. People had concerns. Nothing was really happening that was bad to them. It's just people were concerned about having to pay with cash. More and more places don't use cash around Massachusetts. So we were also at the same time, would you say, struggling with end-of-day reconciliation and collecting copays. I think we were collecting like 40% of copays due. We were collecting at the front end, and we ended up going through a focus group with all of the area supervisors and some front desk staff to talk about, like, okay, how can we increase the copay collection rate? And it quickly turned into everything that's wrong with taking cash or collecting copays via cash. at the front desk, and how it actually ended up being at the bank. And so we took that.
It was amazing. I mean, David, you're absolutely right. I remember that design session where we were talking about the cash drawer. You know, these bags with with keys on them, and people carrying these bags all over the enterprise with cash. Sometimes, you know, they would have checks and cash under their keyboards, and they would have to stay late to close out. And what was amazing to me is that we made the end users comfortable enough that they told us all of this. I mean, some of it you could argue would be embarrassing. Like, why is the operation, you know, without control around cash? And every time we looked at things we could do to improve the process, cash was a bit of a stumbling block. And at one point, I think it was actually you, David, that said, "Why don't we just get rid of the cash?" You know, so we don't have zero cash system. If families do want to pay with cash, we do have a cashier in a central location. But surprisingly, we've almost eliminated it. It's got to be 97% eliminated at this point. And
getting rid of the end-of-day reconciliation was a huge saver, not in just you know, money, but in time. They were taking front desk staff offline like an hour before the end of their shift to go through a full reconciliation process because it's quite burdensome. We didn't have direct connections with a credit card processor and our EMR. And that was the second thing that changed in our journey was our partnership with Instamed and doing the direct Epic Instamed integration at the front desk, at our kiosks, and on our patient portal. And it wasn't just about credit cards, but also tokenization of those credit cards, so the patient and family don't need to keep presenting the card, because again, you're bringing the two kids, one in each arm, you know, to the front desk, keeping track of all of them. The last thing you want to do is start pulling physical materials out of wallets. We also implemented e-check scanning. So if all you're doing is collecting credit card payments or token payments and e-checks, you don't have to reconcile anything at the end of the day. Epic is reconciling everything itself on the Epic side, and then Instamed is doing the same on the back end. And so you're just taking the two reports and making sure that they match at the end of the day, and it's done centrally.
And before that process was in place, our physicians organization had one FTE in an accountant that was reconciling problems each and every day, because our front desk staff had to enter the copay amount both in a POS device, point of sale device, and also in Epic. And you know, what if the mom or dad or the child asked you a question while you're in the middle of this process? So we found that there were some keying errors, and they were very hard to track down. And paying a relatively expensive accountant to track down $5 and $10 errors here and there, that's all been basically eliminated. And I think a really wonderful side effect of this work was that putting a system in place where the end users were accountable, they were supported, and they could see the results of their hard work. Each and every day they could see, oh wow, you know, yesterday we were 45% of collections, now we're 50. And they also turned in help desk tickets when the insurance card maybe said $35 and Epic said, you know, $30, and maybe there was some work that needed to be done behind the scenes in Epic so that we were providing the front end staff with the right amount due. So I think we saw major improvements in our measurement system, major improvements in accountability and recognition of the staff. So we actually had a wonderful internal story with a unit that collected 100% of copays due 3 days in a row. We took a picture of those staff members and we put them on our intranet. And you know, you'd the proudest faces on campus. We and others wanted to be those sort of internal. We called them, our intranet is called Web 2, and we call them Web 2 stars. And you know, other departments wanted to be Web 2 stars.
Yeah, there's nothing like a good, healthy internal competition amongst the areas. And I think the end result is, so we started at the 40% range, and we're now above 80% collections on a daily basis.
It's in the mid 80s every day. We've saved probably close to 200,000 in self-pay vendor fees, and that was David and I report to the Chief Administrative Officer, Dick Argus. He likes to say, that was money we just had to bend over and pick up. I mean, we just weren't asking people for that money, and an outside agency was taking a percent of those dollars that we need so that we can support the business and continue to help more families.
If you're just tuning in, you're listening to Payment Matters. I'm joined by David and Kevin of Boston Children's Hospital. David and Kevin, as I'm listening in and you're standardizing the payment experience for these patients, you're moving toward cashless, you're driving tokenization, and the internal results are great. Like you're hitting results within 3 days, which is amazing. What's been the reaction by the patients?
Actually, I'm glad you brought up the families and the family and patient voice, because it's very important to us. We actually have a family advisory committee and a family teen advisory committee who we partner with on a regular basis on initiatives such as the cashless initiative. And Kevin and Kevin's access work has recently been awarded and recognized by the Family Initiative for involving them in these types of decisions. So we never go into one of these initiatives that are going to so heavily impact the family without getting their input start to finish. We have several family members who will sit on committees and help guide us through some of the discussion and give us the reality of how the experience is going to be in their eyes. And it's very enlightening, and I think it's very level setting for many of the areas to hear that directly from a patient. It's very easy for me, David, the tech guy, to come in and say, hey, I've got this great new piece of technology that's going to change your world, and it's going to be great, and they look at you like, no, you're not. You're giving me more work, and It's going to be horrible.
and I can do my best change management sales pitch, but you know what? The secret sauce is when a mom gets up in front of a group and says, you guys didn't collect the right amount, then you sent me a bill, and then I tried to pay the bill and I couldn't get through to anybody on the phone, and this is really an aggravating experience. I've got 2 really sick kids. Can't you guys do better? There's nothing better to motivate people to change than a mom that gets up and the fact that we partner with them and really we don't create something and then have them react. We co-create with them, and sometimes that's hard. Like the mom that we had is, she's pretty tough. I think her quote was, "Collect the right amount the first time and leave me alone." And you can imagine if you're dealing with really sick kids that have had 100 nights in the NICU, they don't really want to be bothered by bills that aren't accurate. So I think it was an important part of the work.
Yeah, another interesting reaction we had from a set of patients, or our physical therapy patients in one of our satellites. We had decided to drop a kiosk in that location because we had one left over from one of our projects, and the patients started using the kiosk to check in, and they would be presented with their balance for that PT visit from their prior one that they just had 2 days before. And so they were regularly paying those balances, and we ended up having a 2-day period where they had a data issue in that building and the kiosk was down. We never thought that we would ever receive a patient complaint about kiosks being down and they couldn't pay their bills there, and they didn't like that experience that they would now have to wait for the paper bill. That was a change we just didn't expect to have from a patient or family group.
Yeah, absolutely. Jeff, you asked if there were complaints about, the lack of choices and cashless. When David and I started this process, we were concerned about that. We were concerned about potential complaints. So we actually put a process in place to capture any complaints that happened during the pilot phase of the work. And surprisingly, there were very few. There were 1 or 2 families that it was really a communication education piece, and it was a good learning for us during the pilot phase. So we started texting and emailing families months in advance of the change so that they had a heads up of what the new experience would be like. I don't recall any complaints after that pilot phase.
Yeah, and I think we also got ahead of it a little bit by we looked in the system to see, well, what percent of our patients are actually paying cash? So who's paid cash in the past year? Because everyone had in their mind it was this really large amount, and it ended up not being a high amount. But then we crossed that list of patients that did they pay with any other payment method at all during that past year? And I think that took away about another 70 or 80% of those. So we had a relatively small, not tiny, but a relatively small population that was only cash paying. So we did account for those. We had some, I would say, a grace period for a couple of the areas that had heavy cash only usage, and they transitioned over to cashless.
Yeah, and I think some of those families may have, if they didn't want to use a credit card or a flexible spending card, I think some of those families transitioned to checks. But I think by and large, having the ability to do Google Pay, Apple Pay, and credit cards and checks, it's been successful. Again, since the pilot phase, we partnered with patient relations to make sure we weren't surprising anyone. I don't think we've had any complaints since the pilot phase.
As these results are amazing, and even your pilot phase results are amazing, and it sounds like the customer, when I said customer, the family feedback has been profound. Do you think this is unique to Boston Children's, or do you think there are things that your peers or other healthcare provider organizations could learn from your experiences?
Well, I think they definitely, could learn from our experiences and, also go cashless. We have a couple other institutions around us who have started to go cashless. It's a little harder in Massachusetts because you have to have some avenue for cash. I think it's something that we're going to see more of, throughout the country. It's expensive to take cash. It's burdensome, and I think with your drive to more patient portal utilization and pre-authorizing payments ahead of time, the need for having point of sale, point of service cash or collections just isn't going to be there anymore. I think best case scenario is in the future a patient is taking care of all of the business and administrative stuff before their visit. Nobody wants to deal with that when they come through the doors. They're focused on seeing the nurse, seeing the doctor, talking about clinical diagnoses. You don't want to be distracted by what was my copay, what's my deductible, what's my max out of pocket, what have I signed, what else do I have to do? They just want to deal with the care.
If you could see what somebody's thinking about as they push the stroller across the street, across our bridge from the parking garage to the lobby, they're not thinking about, do I have a credit card that's going to be accepted at the front desk? They're coming here because their children are sick or injured, and we would love to have the ability to separate the business transaction from the clinical care so that it's streamlined, and we can really be, our front desk staff should really be able to transition to greeters and patient experience representatives, which is actually their title, and they should not have to do a lot of the payment collection at the front desk.
Right, and so that's going to drive your overall patient experience high. It's going to make you, it's going to be a differentiator in the industry. People have a lot of choices, especially in the Boston, Massachusetts area of where to get their care, and they're going to gravitate towards where they have the best experience.
So the thing that I think a lot of organizations don't fully think through is, okay, we're going to take this task off of our front desk. We're no longer going to need to collect payments at the front desk because that'll already be taken care of. What are we going to now do with that staff? And what we hear from the families loud and clear is, what are you doing about the wait time? What are you doing about communicating with me about how long it's going to be? What options are there for me? I've got a 3-year-old here and a 5-year-old, and I'm trying to entertain them for 20 minutes. And I think the staff would love to get out from behind that desk and really engage people. That's what David and I hear when we're talking to them. And I think a streamlined payment process, it enables that. It should actually enhance the service that folks receive. And that's the vision I think we have.
Absolutely. And I think that other organizations should be able to see that, should be confident in taking that jump and that leap of faith that that's going to be okay, and they will see a major difference in their operation.
Those are the payment matters we're tackling today. Thank you to my guests, David Gates and Kevin Pawl, for joining me today. For all those listeners, this is just part one. Please tune in next month for part two. We'll be having more engaging dialogue and discussions with David and Kevin. If our listeners want to learn more about you two or even Boston Children's Hospital, where can they find you?
I'm at kevin.paul@childrens.harvard.edu.
And I'm at david.gates@childrens.harvard.edu.
Well, once again, thank you, Kevin and David, for joining me today. And thank you to all of you for listening in today. Remember that you can listen in to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. You can also listen on Apple Podcasts and Google Play Music, or just say, Alexa, play Healthcare Now Radio. If you have a comment about the episode of the show, follow hashtag Payment Matters or connect with me on Twitter at Jeff B. Lin. You can learn more about the show at healthcarenowradio.com or at instamed.com. Until next time, I'm Jeff Lin. Thank you.